Hi, everybody. Welcome to the UEA's Nursing Podcast. My name's Joe Ellis-Gage, and today I have Naomi and Sian. Hello.
Hi, my name's Naomi, and I'm in my third year studying children and young people's nursing.
Fantastic.
Hi, I'm Sian. I'm a third year adult nursing student.
Okay. So thank you for coming in. So the reason you're here is to talk about one of your placements that you've done. And you guys have done a slightly different placement than the majority of people on the course, and slightly different than a lot of people would be expecting. So you spent 5 weeks out in Thailand. And it was part of our professional development placement, the PDP placement that we have, which is a placement that you guys do at the start of your third year, which is, it's not an elective, but it's a bit like an elective. You try and choose somewhere to go to that you think will help you develop. You might find something of interest. So people go all over and do lots of different things. And for you guys, we'd started doing an international placement, and Thailand was the place that we could go to. And a group of 8 of you went, and you come to sort of tell us about your experiences and your time out in Thailand. So let's start before you even went to Thailand. What made you want to go on an international placement and not, pick somewhere down the road that was a bit easier to get to?
I think in all the UK placements that we get through the course, you don't get to choose the area that you're in. And it was really nice to sort of go and be able to explore different areas that the international placement offered. And as a child student, you got to do adult there as well as paediatrics, which was really interesting.
Sian, what made you want to go?
Well, funny you say that actually, because when I had my interview to come to UEA, I literally spoke about being able to go on an international placement. I think it's something I always wanted to do. And at the time, we didn't know if that was going to be possible coming out of COVID. So when the opportunity became available, I knew that I was going to apply for it. But I think I've always kind of considered life outside of nursing as well, and travel nursing is definitely something that's quite upcoming and a lot of people consider. So I think I wanted to, from that perspective, go to see if that's something I would like to go into, which I think it definitely is.
Okay. And had either of you been to Thailand before?
No.
First time, yeah.
So, okay. And were either of you kind of seasoned travellers? Have you been, out exploring different places, or holidays being sort of more standard and closer to home?
I think I've mainly just been around Europe. I love adventurous holidays and things, but I've never been further afield really than Europe. So yeah, this was very exciting.
Quite a big experience.
Yeah.
Yeah, I don't think I haven't done any backpacking or anything like that. So solo traveling wise, this was kind of the first snippet really.
Okay. And then just to give us a bit of an idea of what you'd kind of done up until that point, where had your placements been in the first 2 years? What sort of experiences have you had?
So in first year, I've had quite a range of experiences. I've been quite lucky actually. So I had a general paediatric ward in first year, and then paediatric theatres and recovery, which I really, really enjoyed. And then in second year, I had another general children's ward, but at a different hospital. And then I had a community placement where I shadowed a community nurse, which was really good. And then Thailand was the next one, first and third year, yeah.
Okay, cool.
Obviously, doing adult nursing, my first placement was on the stroke ward. Then I was in an outpatient hospital, so that covered so many different things, including day procedures and Macmillan Centre.
Okay.
Then I had community, where you do a week of health visiting as well, and critical care, and then Thailand. Yeah.
Okay. So both had fairly varied kind of experience, bit of community, bit of acute ward, and just some theatres and critical care. So you kind of got some sort of acute clinical kind of settings, which are a bit more complex. So probably both of you quite broad experiences before going.
Yeah.
But nothing like what you found when you got to Thailand, I'm guessing.
No, not at all.
It was a whole new experience, yeah.
So we're not going to talk about some of the practicalities of it at this point. We're going to do a second chat with you that talks about how you got there and the finances and all that kind of stuff. But just tell us about the experience of arriving. So you all set off together, there's 8 of you and one lecturer, and you all went together? How did it work?
We sort of got to know each other. We made a group chat of all 8 of us and our lecturer before we went away, and we met up a few times just to talk through any sort of things that we had to organise for it. And then we sort of became friendly from meeting each other a few times. We had some like mutual friends at university.
So you two didn't know each other particularly before you went?
No, we knew of each other, but we
knew of each other. That sounds ominous.
Well, Naomi lived 2 flats below me in first year, so we'd always kind of like knew of each other, but we'd never really become like good friends.
Okay.
Yeah.
Until now.
Yeah, and then we just met up a few times, got on really, really well, and decided we'd book our flights together. And we thought we'd go a few days early just because we wanted to do little bit more travelling before we got to Chiang Mai, which was where the placement was. So we went a few days early to Bangkok and had a few nights there, and that definitely helped us sort of settle, get used to the culture and the time difference as well.
Yeah, rather than arriving and almost going straight into to a shift.
Yeah, obviously some of the other students did do that, and I think arriving on that Sunday and then being on placement on the Monday, I think that was quite brutal because the time difference, I think everyone was affected by that.
Yeah. And even having travelled a bit before to Bangkok, when we still arrived on the Sunday night, it was quite late in Chiang Mai, and I think it was all like quite overwhelming, even though we'd already been out in the country, so it definitely helped to go out a little bit earlier.
Okay. And then where did you stay? So what sort of accommodation did you have when you got there?
So we stayed in a hotel, all of us together, which was, I think, recommended to us by the lecturer or something like that. And we all agreed like that would be a nice place to stay all together. It was actually a really good location, really modern and nice. And we were all either on like the same floor or like 2 apart. So our rooms were like next to each other. So it was quite nice that we were all close.
Okay, brilliant. All right. So then you get to that Monday. Where did you go? What did you do on your first shift?
So we had a minibus that was arranged that picked all 8 of us up and the lecturer each day, which was really, really useful. And we went to the nursing college that we were linked with and basically had a sort of introduction day, got to know our buddies. So we had 2 buddies each who we could make contact with before if we wanted to via this Facebook group. So we met our buddies, introduced ourselves and just sort of went through what the timetable was going to look like for the 5 weeks.
Okay. And what sort of experiences did you get in those? What was when you set out on day 1? You think, right, this is what I'm going to be doing. Where did they say? What were the options? What were you going to see?
So it was divided into 3 weeks in the hospital and then 2 in the community. So we were all paired up in the hospital. So we always had someone else with us, which was really nice. And we felt like the mix of having 1 adult student and 1 paediatric student was really good because I know Sian was with a paediatric student and she found that really useful.
Yeah.
So we're in our pairs and we rotated around critical care, trauma, cardiac care unit, neonatal intensive care and like a male medical ward, which was really good. So we got a range of experience there.
As well as like other wards as well. If there was something you were particularly interested in, they would take you off to that ward and show you around and you could spend a bit of time there going through like the different equipment or patients they see there.
Yeah. And what about like shift times? So, were you doing the same sort of things that you were doing here? You doing 12-hour days or early starts, or how did that work?
Oh, the shifts were a lot nicer actually in on the placement. So we'd in the hospital, actually for the whole placement, it was 8:30 a.m. till 4:30 p.m., which was so much nicer than the usual 12-hour shifts you get here. Yeah. So that was quite nice. So you had a lot of time in the evening, which was nice to do your own thing as well.
And we were in 4 days a week, so usually Monday to Thursday, and then we had Friday as our CPD research day, and then Saturday and Sunday off as like exploring.
Yeah. Okay. We'll come to the exploring in a minute. If we want to find out where you explored and where you went to. And so the first 3 weeks you were in the hospital, how did that compare to the trusts you'd been to, hospitals you'd been to in the UK?
It was very different, to be honest. We kept saying similar but different. That was like a common theme that came up. Their attitudes to healthcare and was quite different. So, for example, their infection prevention and control measures, they were a lot more relaxed in some places compared to the UK, which was quite noticeable. But then they had a really good attitude towards like waste. So, for example, because I'm quite interested in theatres, we got to watch a paediatric procedure when we were in theatres, and they use like metal pots and sterilize them instead of like using plastic, so there was a lot less waste. So there were quite a few like positives to take back as well.
Yeah, that's interesting.
Yeah. There was like some, not so much negatives, but some things that we were quite surprised by, I guess. One of them being a kind of their approach to care, and how they look after their patients just is something that we found was quite different. And also something that was quite shocking to us was the use of restraints, which we hadn't seen in our placements in the UK.
Yeah. Yeah. So, and I'm guessing you weren't necessarily expecting to see that when you got there. It wasn't something that you kind of had thought about before you went. You were just expected it to be a bit different, but the same principles.
Yeah, it was definitely surprising when we went onto the wards and we weren't expecting it at all. But we'd like talk to the nurses who we were shadowing there and just sort of try and understand, you know, why their approach was like that and things.
Yeah. And did you sort of discuss the differences with them? Did you sort of say, oh, we follow this infection control procedure, or we do this back in the UK?
Yeah, we definitely talked about it a lot. Another thing with like the infection control was they had these negative pressure rooms for isolating patients with contagious like, infectious diseases. And they were surprised that in the UK we didn't really have that, and they did. So
yeah, that was something that we all took back and thought that was really amazing. Like, not only do they have infectious wards specifically with all negative pressure rooms, but even on like a male medical ward, their side rooms are also negative pressure, which is just something you don't see here. But also something that just came to me was the use of cameras in side rooms.
Oh, okay.
So they can monitor the patient from like the nurse's station, and also I think in ICU they had that as well, which is obviously something that I don't think you would be not allowed here, but isn't something that happens here. So we kind of spoke to them about that and kind of queried why they do that, and wanted to know more about it.
So basically when they were sat in their nurse's station, they could still see what was happening in all the side rooms from a screen which had a live sort of camera feed going through.
Mm-hmm. Yeah, they had eyes on all the patients, and they sort of talked about why they thought that was like beneficial. And
what was their rationale for it? What did they say?
I think mainly to just have an eye on the patients all the time. So if they didn't really have, they had relatives visit, but not lots. So I think it was sort of reassuring for them to be able to see their patients from any place.
Yeah.
So, I mean, you can see the logic behind it, can't you? Kind of, we have side rooms that you're having to constantly go into. We might have people on a monitor. You might have a central monitoring if you've got a particularly sick patient. But in general, side rooms here are just that, aren't they? They're out of the way and you have to go and have a look. And you can see from a safety point of view how you could argue that having a camera would help. But we've probably all got our kind of confidentiality and patient dignity kind of hat on that goes, you can't just be filming people all the time.
Yeah, we did speak to them about that quite a bit actually. But I think from what we saw, it seemed to work quite well with patients, especially in side rooms, because sometimes, especially if you do have a deteriorating patient or something like that, being able to monitor that patient where not only you as that designated nurse, but from the nurse's station where all the other nurses can keep an eye out, seemed to be something that worked well for them.
Yeah, and I suppose from a point of view of what the patients are expecting, if that's what they're used to, they're happy with that. It might be that works, I guess. Interesting. And what about the sort of conditions and the presentations that you saw? Were you seeing people coming in with the same things that we would see here?
Well, whenever we went onto a new ward and sort of went around the hospital, we'd always ask, what are the top 5 conditions? So we'd say, the top 5. So the nurses would talk us through the most common presentations they had to their ward or unit or A&E. I know when we went to go to the paediatric ward, it was quite interesting because their top conditions were very similar to what I've experienced like on the paediatric general wards here. So there was a lot of acute asthma, bronchiolitis and RSV, and then epilepsy and febrile convulsions as well. And then a lot of like DMV, so diarrhea and vomiting as well. So quite similar, really.
Really similar to the stuff that we'll see. Yeah. And what about with the adult patients? Similar sort of thing, or?
Yeah, I mean, on the male medical ward, they kind of had a bit of everything, actually. They had, I think in their top 5, they had like stroke and sepsis, which obviously we see quite a lot of. But we have definitely bigger designated wards, like a stroke ward, to look after patients like that. Whereas their acute wards didn't have as many beds in them. So like in comparison, their ICU, in the hospital that we were in, they had different ICUs. So they had like a neuro, they had like 3 neonatal ICUs. So they divided them up, but in most of them there was about like 8 beds. So something that I found really shocking was there was quite a few patients on the medical wards who were intubated just on the bay. Whereas you wouldn't find that.
So you're intubated here, you're in intensive care.
Intensive care, but there aren't the beds for that. But also the nurses on the medical ward are trained for that, which I don't think they are. Obviously here we have like the critical care course and things like that. So that was definitely quite interesting.
Yeah, that is interesting. You wouldn't have expected that particularly, and yeah,
even like the ratio of a nurse to patient for the intubated patients. Like here you'd expect maybe 1-on-1 or 2-to-1, but there you could have 6 patients not in ICU, and then with like 1 nurse to them. So yeah, that was quite shocking.
Yeah. And what about the treatments, the drugs, the methods? Were they comparable to what we've got? We've got lots of the same presentations. Mm-hmm. Did they deal with them the same?
I think one thing that was interesting was so they can give out antibiotics there, so you can get them from a pharmacy without prescription, and they'd, particularly on the medical wards, they'd say, we have a lot of problems with drug resistance. Yeah. And it was interesting that they said that because you thought, because you're prescribing the antibiotic, you don't have to prescribe antibiotics. So I think drug resistance was a big thing.
Did they see that link, or did you kind of?
They knew about the link, but it was almost like there wasn't the connection quite made. Yeah.
I think we were definitely more aware of it because we know that you can't just get antibiotics like that. But I think something that we found as well, when we were on all of the wards, we spent time with like our preceptors were kind of like the nurse in charge of that area. So they were really informative, especially about all their statistics. Okay. So Naomi mentioned the top 5, and this is something they're really hot on. They work out for each year all the statistics of all the patients that come in and what are the top 5 diseases, and it slightly changes each year. And their focus is definitely on patient stay and reducing that time, which is similar to the issue that we have here. But something that we saw was they have like plans in place for patients. So say a patient with pneumonia, they have like a 3-day plan of this day they're having this medication, this day they might be seeing chest physio and this, and then by day 3 they want to be discharging them home, things like that. And obviously that isn't always achievable, but they really push to keep to these set plans that they have for each disease, which is quite interesting because we don't have that here, and we do find that like length of stay in hospital definitely is an issue.
Yeah, and I suppose that's a very structured way of going, right, we've got this condition, we know how to treat it, so we'll follow this and we'll fix it. Whereas we have we talk a lot, don't we, about like patient-centered, person-centered approach where we treat everyone slightly differently and we tweak it. But maybe there's an element of efficiency that we don't have as a result of that.
Yeah, I think the care in the UK is definitely a lot more individualised. And there's a lot more communication with patients as well. That we've noticed in the UK compared to in Thailand. It was more, the nurses are more like, okay, right, we've got to do this today, so we're going to get it done. And there was less sort of interaction with the patient and sort of consent gaining as well.
Yeah.
Something on a whole, we noticed that the patients were really accepting of care and treatment. There seemed to be that if you were in hospital, isn't the case for everyone, but if you were there and you were seeking treatment, you kind of were accepting whatever the doctor said.
So it's almost like their version of consent was, I'm here, therefore I'm consenting.
Yeah.
Whereas we would be like, right, we're now going to do another task. Here's what we want to ask you about and get your opinion and your consent for.
Yeah.
And how does their healthcare system compare to ours? Like, is everyone there under an insurance policy, or is it private? Is it a system like the NHS that we have here?
I think for a lot of treatments, like the government help fund them to like the different hospitals. And then there were some things like in the neonatal intensive care unit, there were some treatments that were slightly more expensive, which parents were expected to pay for if they wanted their child to have them.
Oh, so it's like a top up to like an enhanced level of care.
But then that was in the public hospitals, and there were also private hospitals there. But talking to the staff there, I think most of the patients at the private hospitals were sort of tourists or people there, international patients.
Yeah. We did go to the private hospital, and we all found it quite interesting, not only how expensive things cost, but how on like the ICU wards or intensive care, how the patients weren't critically ill at all. Actually, you had patients sitting up in bed, and they were obviously still unwell, but you wouldn't have in public hospitals, and especially here, people who are to that degree of just sitting
and when on the public hospital, you've got intubated people on general wards.
Yeah.
It was quite a contrast. Yeah.
How was that to kind of cope with? And how, I was going to ask the same thing about like the top up of like, you know, if you've got a bit of money, you can have this extra treatment. Is that hard to deal with from your point of view?
Yeah, definitely. I think because obviously with the NHS, like treatment is provided and paid for, and patients and parents don't have to worry about that. So it was quite hard to see because sort of some people could afford it, some people couldn't, and it sort of seemed unfair. Like there were a lot of inequalities. So that was quite hard to find out.
And how did the patients see it? Because like we have it with our kind of, I suppose, our realise how fortunate we are with the NHS and kind of an idealised sort of view of things. Did they just accept that this is just the system, or did they feel the injustice of it?
So. Yeah, I think especially like going back to like the plans that they have in place, it's once you have that treatment, you need to go home. But I think within that time, like we all know that sometimes 3 days isn't enough for someone to be well enough to go home. But also in Thailand, they have a lot of support from the family. So it's very expected to look after your parents or your children when you're taking them home. And they are seen by community nurses. But I don't think there is enough of that here as such. We wouldn't send someone home if they didn't have anyone to look after them. And obviously putting plans in place like that take longer, which is why people spend more time.
I was going to say, like we have a lot of patients who are fit for discharge, but they can't go because they've got the care in place or whatever.
Yeah.
They didn't have that problem there because it was on the family to
it was
pull it
almost
together.
second nature that they would just go home and be cared for by family around them, or friends around them.
That's interesting. So in a way that they've got an easier, whether it's the right way or wrong way, I don't know, but discharge sort of system and this sort of set care plan system where they're like, this is what we're going to be doing. But I guess they're turning over their patients and getting through them probably a bit quicker.
Yeah.
And that's how they're keeping numbers down, I guess, in hospital.
Yeah, we found that as well, looking not only from like a nursing perspective, but like the MDT, and on the medical ward, just going back to that, we did see the physio, but they only saw a couple of patients, but there definitely wasn't an emphasis like we have here of getting out of bed and the benefits of physical health and like exercise, because did find it quite shocking how patients could be in bed all day, and how would that help with their deterioration or not. But I think it's because they are prepared to send them home in that state because they've got the family to look after them. They are focused on giving them the treatment to help them get better, and then the recovery almost happens in the community and at home, which is something that I feel like we have a really good MDT approach here.
Yeah, and we're conscious of hospitalising patients and them becoming kind of institutionalised and losing their independence and all of that kind of stuff, that we want to make sure that they're up and able and we're not perfect at it, but ready for discharge when we're ready for them. Whereas these guys' approach has got a slightly different slant on it, hasn't it? Interesting. And did you enjoy the time in the hospital? Like, what was the best bit about being there?
I think I really loved the time in the hospital. Like, it was so fascinating to see like the differences. I think it was mainly just really good that you got to rotate around so many different areas. So, for example, when we were in trauma, like, I love trauma, and I'd never really get the opportunity to do something as a student here because my acute placement was in theatres. So that was really good. And then they were very flexible with showing us other areas, like we mentioned earlier, like the paediatric intensive care and things.
Yeah, you got to kind of get in and have a good look. And what about you, Sian? What do you enjoy most about the hospital?
I really did enjoy trauma too, but our preceptor was amazing about getting us to do like practical skills. So we saw quite a few burn patients, or there's a lot of RTCs out there from motorbike accidents. So we were able to do lots of dressings and things like that, and that's something that I'm really interested in. But something we haven't really touched on yet was the kind of traditional medicine, and they in the hospital they have a Thai traditional medicine centre where they do see patients, and I think that was really interesting to us to see how they include that within their care. That was something I think we all really enjoyed.
That's interesting.
Yeah, because there was this very modern approach to healthcare in the rest of the hospital, and then there was this traditional approach as well, all within the same building. So it was I think it was really useful though, because we saw some like positive outcomes from it. So there was a woman who they used Thai massage to sort of improve and initiate lactation. For this mum who wanted to breastfeed. And we watched the procedure and it was successful, and she was able to feed her baby. So, and the hospital could make referrals for patients who the modern medicine wasn't really working for them, didn't really provide the desired result, and then refer them to the traditional unit and see if that helped.
That's interesting. So it's not that you get one or the other, it's that you've got, it kind of complements it. It's like we've got we know what the traditional methods are, and they might help us develop on the other ones.
Yeah, we saw as well from a stroke perspective. We saw a stroke patient who was having acupuncture to help with right-sided weakness, and that was really interesting. Especially having a stroke placement in the past, like that.
You wouldn't have seen that over on the wards here.
I didn't even know that was a treatment option. But yeah, that was really interesting.
And what was the most challenging thing of working in the hospital setting before we talk about community?
I think mainly it wasn't to do with the actual care and treatment and things. I think it was probably to do with the heat, because it was so hot out there and in our student nurse uniform.
Because you wore
got
your
quite
you wore your
warm.
UK uniform out there, yeah.
Yeah, it got very hot on the wards, and they did have fans and things, but they were blowing at the patients, of course.
Yeah.
Like, we weren't the priority.
You couldn't go and stand in
obviously.
the way of the fan
No,
and get it all to
exactly.
yourself.
Yeah.
No, I think not that this was. It's not a negative thing, but I think it could be a challenge for some people. Was the almost constant rotation, because we spent 3 days roughly in each ward. And was obviously constantly rotating between different preceptors and different patients. And it was really nice to have the other nurse that you were partnered with, like the other student, because that was a familiar face and you really worked together. But just trying to obviously take in all the new information and learning.
It's probably quite exhausting.
Yeah, I think so. I think because you want to always get as much as you can out of that experience. So it was kind of changing every couple of days, and you're really trying to make the most of it. So it's not a negative thing, but just a challenge to kind of be on the ball all the time.
Yeah, so the idea is you get loads of experience, go out, see all these different things, but the challenge is that you're trying to fit all that in. And normally on a normal placement, you're probably 2 or 3 weeks in before you even get settled.
Yeah.
Whereas you didn't get anywhere near that amount of time in one place.
No, but that's why I think, obviously, we all had lunch together as well, which was really nice. And we had met the preceptors before, most of them before we actually went on to the wards with them. So they knew us, and everyone was so friendly.
Yeah.
That's something we definitely have to praise them for, that they were so accommodating. The students at the college, as well as nurses on the wards, that we would just walk past, that everyone was so nice to us and made us feel really comfortable. So yeah, I think that's something we can't fault them on.
Yeah, so you were really welcomed in. Yeah.
Definitely, yeah.
And then tell us a little bit about the community. What did you see there? How was that different to community nursing in the UK?
We saw a range of things in the community, so both paediatric and adult. So we went to this institute for child development, and it was for children with complex needs and learning difficulties, developmental delay. So we got a tour of the facilities, and it was just really amazing to see everything they had there in place for these children. So there was physiotherapy, speech and language. We got to sit in on a communication session as well for a child with autism. So that was really amazing to see that. And then we also went to an elderly school. So they really encouraged learning and development, even past adulthood into the elderly population. And it was just a really amazing place.
Yeah, that was one of not our favourites, because you have so many different favourites for different things, but we all really enjoyed our day there, because they, like Naomi said, put the emphasis on developing skills in later life, and also they teach them dementia exercises to prevent dementia, and they were these different exercises we were doing with them, and playing games and learning new skills in order to help them financially, so that they could sell bags or things that they have physically made to also help them, which we just thought was amazing, and everyone there was so happy. We actually ran a bingo game for them, which was really, really fun.
Yeah, it was just a really nice atmosphere there. Yeah, and they had a Buddha come in as well and run services for them.
Yeah.
So there was that really holistic approach as well, the whole time.
Yeah, and quite kind of focused on health promotion or just well-being promotion almost as much as anything else.
Yeah, that was really interesting to see. And then we did go to was it a welfare development centre? Which is kind of, you could compare it to the equivalent of a care home here. And that was definitely really interesting to see, because I do work in a care home. So to have that differences as well. And there was a lot of equipment and physio that they had there as well, which is something that was really great to see, because that's something that's quite hard in the care homes here to have.
Yeah. Okay. Interesting. and then so we've heard quite a lot about your experiences kind of from your placement clinical kind of point of view. But what else did you do? What did you do in your spare time? So you've got every evening and weekends, and how was that?
We definitely made sure we made the most of like our spare time. So we'd sort of do some like of our work and studying and things and reflections from the placements in the evenings, because there was a lot of free time then.
Yeah.
So we had more time sort of Friday, Saturday, Sunday to go off and explore and travel.
Yeah, we really, both before we like went out there, obviously we met up quite a few times, and we both knew that we wanted to travel whilst we were out there, because I feel like you have to.
Yeah.
But we found like Chiang Mai, where the placement was such a good location. Like it was definitely the favourite food of like everywhere we went in Thailand. And there was a lot to do in the evenings, but also it was quite a central location, or a good place to get travel to other places.
Okay.
So we went off with like some of the other students to different parts in northern Thailand, and then we also went down to one of the islands one weekend, and yeah, tried to get. Obviously, you couldn't really do a traveling experience, and that wasn't what we were there for. But we did want to experience the rest of Thailand, or as much as possible. And I think we ticked off like
Definitely.
a lot of things that we wanted to do.
We had ideas in our head of things like places we wanted to go to and recommendations, and we definitely got around and did most of them.
Yeah, we were staying in hostels like for the first time as well, and met loads of people backpacking and traveling, and it definitely was. Yeah, it was almost like a separate experience to the placement in some ways, because it was a first for us doing that. But it was amazing. I mean, we met some people in one place one weekend, and then 2 weeks later we'd go to a different place and we'd meet up with them again, and that was really random. I think you find that with traveling, that it actually is such a small world.
And you get a little community of people out there.
Yeah, definitely.
But it's nice to know that you're not just spending your whole time working, or that your downtime you're just exhausted and you haven't got the opportunity to do anything else. You can go and explore, and because you're all off together at the same time, you can go and explore with your friends. Yeah.
It was definitely like really good to share the experiences with each other, because we really did some amazing things, like all the island tours in the south, and then there were we loved waterfalls. We went to so many waterfalls and jungle treks and things.
Yeah, we done almost like not everything you could do, because that's a bit naive, but we done as much as we could, whilst also like taking time to like kind of process what was going on in the hospital and on placement. But another thing that was really nice on the weekends is that the buddies that we have from the college out there arranged like activity days for us.
Okay.
So on one of the weekends, we spent the day with our buddies. We went to some markets, and we had this really nice lunch on this lake, which I think was a reservoir. Was it?
Yeah,
reservoir?
I think it was a reservoir with like mountains in the background. Yeah.
It was really nice, and we spent like a full day with them and like the other students who came out together, and that was a really, really nice day, and we really appreciate that they arranged that for us.
And did they were there like stuff in the evenings or other events or anything else that you kind of attended or went to as well, or is it completely in your own free time, do what you like?
We did, so towards the end of the placement, we had a lot of cultural exchange activities in the first week, where so we put together a pub quiz because we thought that was very British.
Yeah.
And we led the pub quiz for the students at the college there, and then they did some like dancing and sort of shared their culture with us, which was really lovely. And then in the last week, they dressed us in traditional costume and took us to a cultural show, and we all had a meal there as well, which was so lovely. And some of our preceptors from the hospital came as well, so we got chatting with them, which was such a nice evening.
Yeah. Okay. Now, so one other thing that people might be interested in is sometimes they might think, right, going to the other side of the world to go and do a placement. What if something goes wrong? So unfortunately for you, something did go wrong.
Yes.
Tell us what happened.
So on one of our weekend adventures, we went to Pi for the weekend, which is like north of where the placement was, and there was an accident where I was tripped over and fell onto a glass and cut my hand open quite badly, I think it's fair to say.
Yeah.
But it was obviously quite stressful, but Sian looked after me very well. She was like my nurse, and we managed to go back to the hostel, and the people working at the hostel were really good. There was even a girl there who was a nurse.
Okay.
So she was very helpful too, and they all looked after me really well and took me up to A&E, and got my
Put you back
hand
together
stitched
again.
up, repaired me. But yeah, it definitely, there's no denying that it was a stressful experience for sure. But luckily Sian came in to A&E with me, because they were reluctant to let her in, but she came in the end and looked after me, which was really good. Yeah.
Yeah, and we also spoke to our lecturer who was out there at the time, because we had a bit of a decision to make about whether we stay and have Naomi's hand stitched up in Pi, or whether we go to the private hospital in Chiang Mai, because they knew that we had insurance, and they were kind of not promoting it, but saying, if you want to go there, you can go there. There was...
And you didn't know what the best
we
option
didn't know
was,
what the
really.
best option to do was, and it was the early hours of the morning.
Yeah.
So we spoke to our lecturer, and she was amazing. She gave us all the reassurance we needed, and we then went to the private hospital when we got back to Chiang Mai, and she came with us to make sure that everything was all right. And we had good care out there, but it was definitely interesting to see it from the patient's perspective.
Yeah,
Not that was by any means an intention.
No. I wouldn't recommend it, but it was absolutely fine, and it all got sorted, and it was very well looked after. Yeah.
Okay, yeah. So stuff goes wrong, but there's systems in place, there's
Back
support in
one
place.
piece and it's fine.
Yeah, exactly.
Yeah.
It shouldn't be something like you should worry about. And before going on the placement, we done risk assessments, and we talked about the risks of almost everything, not specifically that situation, but we knew what could happen, and we knew who we could contact, and all the students in general we were always looking out for each other. We had a group chat, and even not from just a physical accident, but from a mental health perspective, we discussed before we were going out there that some people might feel lonely, and we're not going to have our support systems in place like we normally would at home. So we all made an effort to really look out for each other, and when someone was going to just grab dinner in the evening, we put it in the group chat, or we made sure that everyone was included. Which was really, really nice. Yeah,
so you kind of look out for each other and look after each other, because it's quite a big deal if you are suddenly feeling nervous, or you're having a down day or whatever, and you're a long, long way from home.
Yeah, definitely.
Good. So thank you for telling us all this. You've told us loads of really interesting stuff about your time there. Is there anything else that we've missed? Anything that I should have asked about that we've not discussed, that you wanted to add in, or have we kind of covered most of the experience?
I'd say we've probably covered most of it. I think our advice would just be, if you're thinking about it, if you're thinking about applying and doing it, just go for it, because it's such an invaluable experience. We loved every minute of it. We still talk about it every day. Wish we were back there.
Yeah. I think just if you're even thinking about it, just apply for it. I think all of us had the best time out there, not only experiencing the placement in Thailand, but going to obviously that amazing country and experiencing it. Me and Naomi have become really, really good friends now, and before this placement we probably wouldn't have, and even just things like that, it's not like any placement that you will experience in the UK, and there's so many transferable skills as well. That isn't a negative. That's a bonus. That's an amazing thing.
Even with the language barrier, obviously was an issue, but it's like developed our communication like so well, because we've had to find so many new ways of talking to the nurses and talking to the patients. So yeah, there's definitely a lot of amazing things you can take back.
Yeah, brilliant. Well, thank you very much. Hopefully you've found this chat with Naomi and Sian interesting and informative. If you have, then please like it, share it, send it to your friends. Add any questions or comments below if you're on the YouTube channel, and we can answer those. If you are a UEA student who's looking at maybe applying for this in the future, then keep an eye out for our other video that I'll share with you separately, where we look at some more of the practicalities of things. But thank you, and thanks again.
Thanks for having us.
Okay.